This mother is in a laid-back position. She is leaned back slightly with her legs comfortably elevated and her arms and elbows supported with pillows. Her baby is sleeping right now, but this mother is ready to feed as soon as her baby shows signs that she's ready. For most babies, latching is easiest in a laid-back position because gravity holds the baby close to the mother. For most mothers, this is also the most comfortable position. Here the mother is holding her baby diagonally across her own body. Babies don't like their feet dangling, so have your baby's feet supported by your hands, your body, or a pillow beside you. To bring your baby in closer, you can press gently on your baby's upper back. Here the mother is holding her baby horizontally across her body. Hold your baby on whatever angle is best for both of you. It's important that you and your baby are as close as possible, tummy to tummy. This will help your baby feel safe and secure so he can focus on feeding. This little baby is sleeping comfortably on her mother's body, skin to skin. Holding her baby skin to skin increases the mother's breastfeeding hormones like oxytocin and regulates her baby's temperature and heart rate. Mother and baby spend as much time as they can like this, perhaps with a light blanket over both of them. Right now, this baby is in a light phase of sleep, which you can see by her fluttering eyelids and other movements. These are signs that she will be ready to feed soon. The baby is now awake, alert, and showing signs that she wants to feed, like opening her mouth, putting her hands in her mouth, and moving her head from side to side. When the baby shows signs that she is ready to feed, her mother gently moves her slightly below the breast. From here, her baby can reach up and latch comfortably with a large amount of breast in her mouth, not just the nipple. The baby's arms are on either side of the breast, not in front of the baby's body. If the latch is not comfortable, you can try pressing gently on your baby's upper back, which will bring the chin in closer and allow the nose to tip back. If your baby needs help latching, hold your breast in one hand and support your baby's neck and upper back with your other hand. Avoid touching the back of your baby's head. Bring your baby to your breast. When your baby's chin touches the breast and his mouth opens wide, gently latch your baby. Watch now as this mother demonstrates the difference between the amount of milk removed with a shallow latch compared to a deep latch. With a painful shallow latch, the baby takes only a small amount of breast into his mouth and very little milk is removed. With a large amount of breast in his mouth, the latch is comfortable and the baby gets plenty of milk. This shallow latch needs some adjusting. The baby's chin is tucked down into her chest and she swallows very little. Watch her mother fix the latch by pulling her baby down below the breast and bringing her baby's chin deep into the breast, which allows her baby's head to tip back. Now the baby is drinking well with lots of swallowing. Notice how both of the baby's cheeks are touching the breast. This keeps the nipple centered in the baby's mouth. With these adjustments, the mother's nipple is comfortable and her baby is able to remove milk easily. This baby is 1 week old and her mother's milk has come in. In the first 3 to 5 days, when your baby is drinking thick, nutritious colostrum, swallowing will be much less frequent. This is normal. With each swallow, a baby's chin will drop and pause briefly. After a swallow, you may hear your baby breathe out with a sound. You will have several letdowns of milk during a feeding. You may or may not feel them. Between letdowns, your baby will take short breaks. When your baby is drinking well, there will be steady sucking and swallowing. If your baby breaks the suction, you may hear this click sound. Press gently on your baby's upper back to bring the chin deeper into the breast. As the feeding progresses, the bursts of sucking and swallowing become less frequent, and the spaces between these bursts becomes longer. Let your baby stay on the first breast as long as you see swallowing. Scratch mitts and swaddling can make latching more difficult. Instead, let your baby use his hands. Your baby may come off the breast on his own, or you can release the latch. Offer the second breast at each feeding, especially in the early days, to ensure your baby gets all the milk he needs and that you make plenty of milk. Your baby may take a little, a lot, or none from the second breast. After finishing the first side, this mother puts her baby upright on her chest for a few minutes to see if her baby wants to burp, have a little nap, or nurse. Hiccups are common. They usually bother parents more than babies. After a short nap, the baby is awake. Her mother moves her to the breast. The baby is relaxed, so the mother waits patiently for her baby to take the breast. No need to rush. This latch is painful, so the mother decides to release it. You can usually adjust the latch while the baby is nursing, or you can start over. Relatching too many times can cause pain and frustration. The mother has moved her baby into a better starting position, slightly below the breast. Once latched, the mother adjusts her baby to bring her baby's chin deep into the breast, which allows her baby's head to tip back and her nose to tip away from the breast. The baby starts sucking and drinking well. Notice how the mother makes little adjustments throughout the feeding as needed, by pressing on her baby's upper back or by moving her own arm. Your own nipple comfort is an important guide to a deep latch. If the latch is painful, keep making little adjustments until it is comfortable. If your nipples are already damaged, they will likely be tender, even with a good latch. Breastfeeding can continue while your nipples heal. If the pain does not improve over the next day or so, seek lactation support. As the feeding progresses, the bursts of sucking and swallowing become shorter and less frequent. This feeding is almost finished. The mother can choose to leave her baby on the breast for another minute or more. It's up to her. The baby is finished nursing now. Her mother can feel that her baby is no longer firmly latched. She allows her baby to let go of the breast on her own. This baby is clearly satisfied, relaxed, and ready to sleep. If you want to help your baby get more milk during a feeding, you can consider doing breast compressions. This technique is used when your baby is sucking but no longer actively swallowing. It is usually not necessary, but can be helpful in some situations. Grasp as much of the breast as you can with your whole hand. You can do this by placing your hand over the top of your breast or by placing your fingers under your breast with your thumb on top. Gently squeeze. This will push milk to the nipple and into your baby's mouth. Do not squeeze so hard that it hurts. Your baby should start to swallow after a few moments. Hold the compression until your baby stops swallowing. Release the compression and move your hand to a slightly different place on your breast. When your baby starts sucking again, squeeze your breast again. Repeat the squeezing and releasing until it no longer works. The sideline position can be helpful because it allows your whole body to rest while you're nursing. Lie on your side with your knees bent up and pillows supporting your head and lower back. Place your baby so that his nose is level with your nipple. Pull him in close to your body with gentle pressure on his upper back. This will bring him in chin first and allow his head to tip back. Gently latch your baby. See our LLLC Safe Surface Checklist and Safe Sleep 7 for important information when using the sideline position.